An amiable welcome to everyone. This is your Allied Lecdem channel to enhance your understanding. Our department videos will be available in the playlist. You can check it. Today we are going to see about hemodialysis. Hemodialysis is the removal of solutes and water from body across a semi-permeable membrane, that is dialyzer. The father of hemodialysis is William Koch, who invented the first artificial kidney. The principles of dialysis are diffusion, osmosis, ultrafiltration and solvent drag. Diffusion, movement of molecule from an area of higher concentration to area of lower concentration. Osmosis, movement of solvent molecule from lower concentration to higher concentration. Ultrafiltration and solvent drag. Water moves from an area of higher pressure to an area of lower pressure. More efficient in fluid removal than osmosis. Molecules which are dissolved in the solvent also get removed in solvent drag. The indications are acute poisoning, acute renal failure, severe edema, chronic renal failure, hepatic coma, hyperkalemia, transfusion reaction, cardiac tamponade, etc. And the contraindications are other chronic disease, no vascular access, hemorrhage, hypertension, very old people, coagulopathy, inability to survive the procedure. Vascular access, AV fistula, AV graft, AV shunt, percutaneous access are the vascular access which are used for hemodialysis. AV fistula is an anastomosis of an artery to a vein, and the sites are radial artery and cephalic vein, brachial artery and cephalic vein, brachial artery and basilic vein. It increases the blood flow and pressure causes the vein to dilate. The complications of AV fistula are thrombosis is due to hypotension, aneurysm due to repeated area puncture, and Steele syndrome is due to reduced blood. AV graft. A graft is put between artery and vein. Synthetic graft is used more commonly, and the indications are peripheral vascular disease, diabetes, and it can be used after 14 days. AV shunt. It is very rarely made. Teflon tubings are inserted into the vessel and silicone tubings are attached. The percutaneous access like internal jugular vein, subclavian vein, femoral vein. The indications are acute dialysis, temporary, inadequate vessel and failed access. The cannulation. Allow the fistula to mature. A thorough physical examination is done before cannulating. Adhere to UNIT's protocol. Universal precautions are followed. A tourniquet may be used to get the vessel encouraged. The type of cannulation: rope and ladder puncture, area puncture, buttonhole puncture. Rope and ladder technique. The entire vessel is used systematically. Each needle is inserted at 2 cm above the last side and back again. It helps expand the lifespan of the fistula. Gives the previous stick side time to heal. Helps the fistula mature and move evenly. Buttonhole technique. The same site is repeatedly punctured at exactly the same angle. Over time, the scar tissue develops, guiding the needle into the right place. And the advantages of buttonhole technique are less pain, less hematoma. Area puncture. Use of 1 or 2 areas of the fistula which are regularly used. Aneurysm chances are more. The cannulation technique. Needles to be inserted at 45 degree to the skin. Atrial and venous needle should be placed 5 cm apart. Don't pull or push the needle blindly. Ask for assistance if cannulation attempt had failed for 2 or 3 times. Hemodialysis equipments are dialyzer and the membrane. The dialyzers are coil dialyzer, parallel plate dialyzer and hollow fiber dialyzer. These are the different types of dialyzers are used. The membranes. Flux property. The efficiency with which a membrane clears water and solutes. Cellulose membrane, low flux. Modified cellulose membrane, which are low or high flux, and synthetic membrane, low and high flux. The preparation of the dialyzer. Hair must be completely removed from the dialyzer and the bloodlines. Removal of the chemicals or the sterilizing agent is essential. Minimum of 1 hour of saline for flushing in ETO sterilization. Dialysate. The fluid which is pumped on the opposite side of the semi-permeable membrane to the patient's blood, and it is prepared by mixing a concentrated electrolyte solution with a buffer, that is bicarbonate, and purified water. Next, the composition of dialysate are sodium, potassium, urea, creatinine, calcium, magnesium, glucose and bicarb. Here we can see the composition of these dialysate in blood and in dialysate. Anticoagulation. Heparin is the beginning of 2000 to 5000 units or 50 units per kg, and then as continuous infusion at 1000 to 1500 units per hour till 15 to 60 minutes before the end of the dialysis. Heparin free dialysis if any bleeding disorder is there. Thank you.